Hi everybody, how are you? It's Dr. Emily, functional podiatrist, human movement specialist, author of Barefoot Strong, and inventor of Novoso. So I want to do a video to teach you how to use a dancer's pad so that you can get the most out of this modification and how it can help you reduce pain in the great toe or the sesamoids. So a dancer's pad is a padding that looks like this. This is a pre-cut one, but you can also make them yourselves. Again, this is a dancer's pad. Where I use dancer's pads in my office is for sesamoid issues. If a patient is coming in and they have sesamoiditis, maybe they have an acute sesamoid fracture, or we have a ligament or an inflammation surrounding those sesamoids and the sesamoid joint. I also use dancer's pads for those that have hallux limitis, which is a limited range of motion of the great toe, as well as those that have a functional hallux limitis or a first MPJ capsulitis, so great toe pain. Really, this is for pathology in the first MPJ area and apparatus. So what we're doing with the dancer's pad is that we are offloading the area and trying to change the timing of the way that forces go through the first MPJ. This is oftentimes a temporary treatment that I will use for my patients so that we can see how they respond to it. And then oftentimes if patients respond very well to the dancer's pad, you can easily build this into a custom orthotic. Now those that might have a transient inflammation in the great toe, these are something great that you can use. I also like that these stick directly onto the foot, so a lot of my yoga instructors and Pilates instructors will use this while they are teaching classes or in their practice so that they can still be barefoot but get better control around that first MPJ or around those sesamoids. So when you're looking for a dancer's pad or trying to use a dancer's pad, two things very important. First one is you want to make sure that you are getting the correct dancer's pad. You want the appropriate material and the appropriate thickness. Second has to do with placement. So let's go into the appropriate dancer's pad. So I have a felt dancer's pad. So this is felt. A lot of other dancer's pads you get can be made of foam or silicone. This is a 1/4 inch. So 1/4 inch felt dancer's pad. It's pre-cut and it has an adhesive on the back. Now the placement, you want to make sure that you're matching what you order to the foot that you are trying to actually offload. So this technically, if I stick it onto my foot, would be a left foot dancer's pad. I'm going to show you exactly where you want to place it. So if we are looking at the foot, so here's my foot, the area that we are offloading is the first metatarsal head or the distal aspect of my first ray. I'm going to show you where I put it on my foot. Again, it has an adhesive, so we just take off that back. And then we want to look at the bottom of the foot and we're going to place it in the area. So this is very important that we get this appropriately. Okay, great. Okay, so the placement on my foot, so you can see where it's placed. What it's doing is that it's allowing this cutout right where my first metatarsal head is. It's also bringing the ground closer to metatarsal head 2, 3, 4, 5. Yes? So for those that have a functional hallux limitis or hallux limitis, this can change the timing of how we go through our great toe joint. Very effective modification for those who have hallux limitis. It's also offloading the area where the sesamoids are. So now this placement, this would be the ideal placement. You want to make sure that it's not too distal or too far forward towards the toes because you could actually be on your sesamoids and then that's going to create more pressure than the actual offloading that we're trying to get. Now let's say this is something that you actually notice a difference. Do you have to continuously stick this onto your foot day after day? Absolutely not. What we do is we can either take the same over-the-counter felt dancer's pad and we would put it on our insoles. So I have the insole of my left shoe here, just a simple insole or sock liner, and you're going to place the insole on your foot to make sure you get the appropriate placement to offload, and then I'm going to put the padding directly onto the back of the insole. So this would be the front of the insole. This is how it's going to go into the shoe. On the back is where the placement of the dancer's pad is. So when I put this in my shoe, it's going to offload my first metatarsal head, my first ray, my sesamoids, without me feeling the ridges of the padding. Now, if you also like this and you want it from a more permanent perspective, this is super easy to put into a custom orthotic. It would actually not be called a dancer's pad then. That modification is often referred to as either a kinetic wedge or a reverse Morton's extension. So again, this is another one of my favorite paddings that I use in the office. I would say my two most common paddings that I use is the metatarsal pad and the dancer's pad. You will often know if this is going to help you right away. I hope that you enjoyed, that you found it beneficial, and always stay barefoot strong. Take care.